Hello, I'm Michael Pierce, and this is The Human Condition. Well, today our topic is support methods for trauma, persistent trauma, and these are several types of trauma. So, what I'd like to unpack for you today is the three types of trauma generally, and there's certainly more, and some alternative methods, and there's certainly more. But there is kind of considered that most people will get either drugs and medication or they'll get some kind of talk therapy. And that's great. That's great. It's wonderful. And it works great for a lot of people. If and when it doesn't work so well, or it isn't complete, or it's not working so well, or it backfires, there are times that we need to work on that. And I'd like to propose some creative solutions that I've seen work. And yes, I don't have double blind studies for all of these, but I have some good preliminary data from a lot of different sources. And I'll try to discuss some of that with you today here as we go. Now, if a person has some trauma, the trauma could be physical. It could be a trauma to the brain, like a mild traumatic brain injury, a moderate or severe brain injury. The lines for that are not important for us right now, but some of them involve whether the head is opened or not, whether the skull is cracked open or not, and how severe and long lasting the symptoms are, how neurologically sticky they are. Those are the definitions between mild, moderate, and severe traumatic brain injuries. There are developmental traumas where a person develops or fails to develop through a particular childhood phase. And that can happen super early in life, or it can happen a little bit later in childhood, or a little bit later in adolescence, or even later on in early adulthood. Those cause characteristic brainwave changes in some people. So we see those on EEG and a little bit on ERP. Those are things that can show us kind of a developmental, kind of a PTSD, if you will. So post-traumatic stress disorder can happen to adults, it can happen to children, and it can happen chronically over time. There is chronic PTSD where a person may experience traumas that are of an emotional nature and not so much physical, or both, where they're physical and emotional. And those can happen in childhood and be repeated, or they can be discrete, separate events that have nothing to do with each other over time. A person can get multiple ones of those in adulthood, or maybe a few in childhood and a few in adulthood. They can be similar in nature, like they can all come from boxing or bicycling and falling off your bike, or football, or some similar activity that you do a lot of. Or they can be mixed. You can get one from falling off a sailboat, and one from motorcycle, and one from falling off a horse. These are very, very common types of things, and you can mix them together. There can be physical traumas to the head, and there can be non-physical emotional traumas, and they work together, and a person can be quite impaired by those over time. So when persistent trauma or lasting trauma is, I think, a better term for it would be lasting trauma that is quite persistent, a person is not getting traumatized anymore with fresh incidents, but their old trauma is sticking around and they can't seem to shake it off. That's what I'm talking about. So I'd like to discuss a couple of things. The first one that I'd like to mention is the power of brain chemistry. It's extremely important to consider that brains do very, very well in some cases with reducing the volatility of their chemistry of their fuel. And that means reducing carbohydrates and reducing processed foods. So what we do with the traumatized patients is give them a ketogenic diet or a carnivore diet and see what happens. This is very inexpensive. It doesn't cost much at all. And we can begin to learn how a person performs if we know what we're doing by getting rid of seed oils and omega-6 oils, by getting rid of processed oils, by getting rid of processed foods that are full of chemicals. We have lots and lots of chemicals in the United States that are not allowed in other countries. Those are highly toxic and dangerous to the brain, and we have to get rid of them. We may sometimes even need to test a person for toxicities. We may need to do urine tests and hair tests to look for mold and heavy metals and pesticides and fire retardants. There are a number of fire retardant chemicals that are in our blood and our urine, and we need to identify those and detoxify those. There are estrogens that can be found in our urine and our blood and our saliva that we need to sometimes detoxify. Some of them are natural estrogens that are made by us, and some of them are exogenous estrogens called xenoestrogens that are brought in from things like fragrance. The most common estrogens that we get exposed to are plastics and microplastics, as well as fragrance. When you read a product for your personal care and it says fragrance, Think of that as estrogen and don't use it. Get rid of it because you can't trust the word fragrance. It's just not regulated enough. And more times than not, if it says fragrance, it's going to have some kind of estrogenic molecule that triggers all the systems in your body to react to and produce estrogens. And it's worse for women than men, even, of course. So that's one approach. I also want to remind you that there are some findings that'll happen. There are some biomarkers in EEG, which is brainwave analysis. We frequently see people that have concussive signs. There may be signs of white matter disease or damage that are focal in different parts of the brain over different electrodes or regions of the brain that might indicate that there's been long-term trauma or ischemia, which is a lack of blood flow. We also tend to see shifts in alpha waves and shifts in activity in the right posterior area, which is the right temporal area, and that area tends to be a real warning sign for chronic PTSD. It's one of many biomarkers, and it doesn't mean that it's what we call pathognomonic, which means it's always a sign of PTSD. But if one has a real problem with alpha waves shifting in their frequency or intensity in that spot and not the corresponding spot on the opposite side, we often suspect and have found a high correlation between PTSD and the person's brain waves. So think about that. It's behind the right ear. It's actually back above and behind the right ear on the right side in most people. We want to also look at the fact that some people have hypervigilance. They have problems with their resting state and they have hypervigilance. They don't sleep, or they have a problem with their what's called a P300, where in some cases they might respond too rapidly to a stimulus. So they're doing a brain test with the cap on their head and they're given a signal and they're told to respond to that signal. And the latency or the speed with which they respond to the signal is hyperactive and they're hyper aroused and they've got all kinds of jitteriness that's pretty indicative of really active stress and strain. And all of this can be trained away with what we call traditional band neurofeedback, which is where we work at wave frequencies from the delta waves up to the gamma waves. And those are, from 1 hertz to 30, 40 hertz, somewhere in that range. And we train people to reduce some of those waves or increase some of those waves or shift those waves from one frequency to another so that their dominant frequency moves up and down the scale. And all of that amplitude and frequency training can be done traditionally with pretty inexpensive and pretty common equipment in offices all around the world. There is another treatment that I really like that is a treatment for trauma. And it is a reset treatment, which is infralow frequency. These are frequencies way below delta, way below 1 cycle per second or 1 to 2 or 3 hertz or cycles per second. These are in the realm of, 0.0030, that kind of range, somewhere way down in the low frequency range. And messing around in that area with a professional, someone who knows what they're doing, can really be very helpful for trauma and has been shown to help get a hold of a person's dominant frequency and help them shift to a more optimal frequency that might work for them in cases of developmental trauma as well as childhood trauma and, of course, severe adult trauma. So I think that when a person gets locked into a problem where counseling can't snap them out of it, herbs can't snap them out of it, they've got some options here that could be extremely useful. And I've seen a lot of this in the last 30 years of practice. I also want to mention that microdosing of mushrooms is extremely safe. There is a small risk of some people with a familial or genetic tendency to have psychotic breaks. Also, there's a rare occasion of seizures, but it's an extremely safe method that's probably safer than most sports that we do. So working with people, not just the heroic doses and not just the trips that people do with a psychotherapist, those have their own efficacy, and I'm not here to talk about those. You can talk to another expert about that stuff. There are better experts than me on those things. What I'd like to talk about is the microdosing concept. And I think that we're going to see microdoses used in a great number of people with trauma with various types of mushrooms and other type of psychedelics that when they are brought to a microdose can be really, really safe and really helpful for people that are trying to just break out of this. I've seen anti-inflammatories work quite a bit. There are a number of people that have just a lot of inflammation, and sometimes just taking an anti-inflammatory or an antioxidant Anti-inflammatories include things like turmeric and Boswellia serrata, vitamin C. Some people use N-acetylcysteine or glutathione. There are many, many antioxidants out there. All of the fat-soluble vitamins, A, D, E, and K, are anti-inflammatory. Omega-3 is anti-inflammatory. Fish oil. You can get some omega-3s from plant sources. I prefer them from fish if possible, and from from other grass-fed animals and organ meats and bone marrow and stuff like that. But the general concept is we can combat inflammation. We also need to make sure that we're combating inflammation with EMFs. We've got to make sure we're not giving ourselves a ton of blue light exposure, and that we're not giving ourselves EMF exposure from Wi-Fi and from EMF sources. You really don't want to stand too close to your microwave. I don't have my meter with me, but I've shown before my expensive meter. There are all kinds of inexpensive and expensive meters that measure EMFs and Wi-Fi and routers and 5G measurements. So it's really important to measure your environment, not only where you are during the day, but where you sleep and in your car. If you've got an electric car with a battery, you've got to make sure that it's shielded or that there's some way of protecting you, because man, there's a lot of EMF in some of these vehicles. So make sure your office, your home, and especially your bed where you sleep has got some shielding, or at least a way to turn off all these different devices, because that can cause electrical inflammation, and electrical inflammation becomes chemical inflammation, and that can cause some real persistent trauma. It can cause sensory changes. It can cause problems in the brain where a person can hallucinate and have all kinds of voices and sounds and visual things. If there are abnormal electrical activity in the back of the brain, you can have visual hallucinations. If there are things in the abnormal activities in the temporal lobes, you can hear things that aren't there. And that doesn't mean that that you are somehow defaulted or more messed up or defective. It simply means that you've got something we need to fix, and we got to find it before we can fix it. I also want to add that one of the things I've seen be really helpful, look at my notes here, with regard to trauma, is chiropractic adjustments. I know this is old school and I don't care. I'm going to hammer on it because it's really important. There are general chiropractic adjustments, and I think they can be wonderful. When you go to the typical chiropractor, you get general manual adjustments, and those can be life-changing. But I also want to remind you, if you've got trauma, there you can consider specific chiropractic adjustments, and the hallmark of specific chiropractic is it tends to be more specific. It doesn't have to involve x-ray, but it can involve x-ray to look at the alignment in a standing or sitting position upright. It may involve leg length analysis. It may involve muscle testing to test muscles and circuits in the body as far as movement and posture and gait. It may involve having you put your limbs in certain positions while they check the legs, or they may push on certain places on your body and then check the legs, or they may try to look at a change in leg length when you turn your head, because all these systems are dynamic. And when you press on something, or you do something with your limb, or you turn your head, you change your leg length, or you change your muscle response through your brain and through the thalamic loops that trigger your motor firing, and the timing and strength of your motor firing, that these things can be really useful. So consider the fact that specific chiropractic techniques are often very, very particular vectors in three-dimensional space, which means the aim is very specific, and they're often very directed at a particular vertebra with less force. Most of them use less force. They don't all use less force, but most of them use less force. So they're very pleasant and very engaging and very fun and relaxing. In fact, a lot of people will find that when the tone of the back of the neck, which in chiropractic we call scanning palpation, which is where you palpate through the muscles and nerves and see if there's less palpable tenderness across the nerve endings and joints of the joint capsules of the neck, that as a person gets improved palpable tenderness, that they get improved leg length, that they get improved leveling of the pelvis, leveling of the head, and straightening of the spine, that they often have much better blood flow to their brain, better lymphatic and glymphatic drainage of the brain, that they have better immune function, that they have better afferentation to the brain and activation to the brain from sensory information that comes up the spine and spinal cord and peripheral nerves, as well as descending control that goes down through the brainstem. It's very important to know that some people are really profoundly affected by good chiropractic care that can help them not only have better blood flow and better brain performance and better immune regulation and endocrine regulation from that, but they also might be able to find toxic memories in their body, because there are some stored memories in what we used to call muscle memory, and the idea that you might have memories that might be brought out. So sometimes when you're working with a counselor, a therapist, a psychotherapist, a psychiatrist, a chiropractor, a body worker, a massage therapist, a neurofeedback therapist, any of the sort, it's possible to have retracing, or to have some kind of flashback or some kind of memory that recalls from some of those traumas. And quite often they're less severe than the original experience. They last less time, they're less intense, they're less severe, but they're kind of like a reawakening or a resurfacing of that event, especially if it's been blocked or it's been pushed away. So whether there's memories or not, I'm not saying one has to go through these memories. I'm just saying that sometimes if you want to, you can access them through these kinds of methods. So I encourage you to consider advanced chiropractic methods like Atlas Orthogonal, NUCA, which is National Upper Cervical Chiropractic Association, the Pedabon method, the Palmer Upper Cervical method, or which is called hole-in-one theory, or Atlas toggle, which is toggle recoil. The chiropractor does a hand position like this on the Atlas with a drop table. The Thompson method, the Gonstead method, the activator method, these are all named methods of chiropractic that are quite specific, that aim at correcting structural imbalances that help with the nervous system so that the brain can ultimately fire better. And I have found really good results in people that get stuck with this. So if you've had a problem, you're perhaps a soldier, or perhaps you're a person that experienced childhood trauma, you're an adult, or even you have a child that's still a child and is having some trauma, I think it's very useful to get those children chiropractic adjustments, get them neurofeedback, get them nutrition, get them detoxed, and get them on some kind of keto or carnivore fuel for their brain so that they have less of those. You get spikes in electrical activity when your brain is overstimulated by stimulants. So you want to stay away from sugar. You want to stay away from rapidly burning sugar. You want to stay away from processed foods, caffeine, nicotine. You want to stay away from, obviously cocaine and big stimulants like that. You want to stay away from amphetamines and from meth. You want to stay away from all those types of things that would stimulate your brain and cause your brain to crackle with extra electrical activity, because that is the borderline of seizures, and that is the borderline of excessive activation. We even call some of these excessive activities excessive spindling beta. This happens in people with inflammation and anxiety. They get beta waves, which are little spindles of very fast moving waves in the frontal lobes, especially. We call it frontal excessive spindling beta, and it's a sign of either inflammation or anxiety, and it can also be involved with PTSD, depending on where it is and what correlates with your own body. So it can be very useful to get these EEGs, to get a 10-minute eyes closed, 10-minute eyes open, and really look at your brain waves and consider all these different methods and find somebody that can do some of these methods. And of course, check out our website. I've got a lot of resources on the website, and every month we're trying to build that website and add more stuff and more resources for you for free. Check out my free book. We're looking at humanconditionlab.com. Thank you.